The inability to achieve and maintain an erection sufficient for satisfactory sexual performance can substantially interfere with erotic pleasure and sexual intimacy. Recent evidence, however, reveals that it can be much more serious than the ability to attain an awesome erection, and I'll talk more about that in a minute. Erectile dysfunction afflicts at least 12 million men in the United States, making it a very common disorder. And even though erectile dysfunction occurs more commonly in older men, it can raise its ugly head, no pun intended, as early as the late 30s and early 40s. Conditions commonly associated with erectile dysfunction include cardiovascular disease, diabetes, hyperlipidemia, high blood pressure, obesity, smoking, sedentary lifestyle, prostate cancer treatment, and endocrine disturbances like low testosterone. Psychological issues also play a role in individuals with sexual guilt, anxiety, depression, a history for sexual abuse, high life stress, and relationship dysfunction are more likely to suffer from erectile dysfunction. Many substances, prescribed or not, contribute to ED. Alcohol, nicotine, amphetamines, cocaine, marijuana, and opioids interfere with erectile function. The list of prescribed medications that interfere with erectile function are many as well, and include antidepressants, antihistamines, blood pressure medications, diuretics, benzodiazepines, and opioids. As you can plainly see, ED is a complex and multifactorial issue. And for many doctors and most patients, it's easy to give into, "Can't you just prescribe me the little blue pill, doc? It's Friday night. I might get lucky." As it turns out, there's much more to it, and erectile dysfunction is more serious than previously understood. So here's the most single important take-home message in this video. Research confirms that erectile function is associated with an increased incidence of heart attack, stroke, and all-cause mortality. In fact, according to Rue, ED typically occurs 2 to 5 years before coronary artery disease, providing a potential window during which men diagnosed with erectile dysfunction can make lifestyle changes to prevent cardiovascular disorders. You heard me. ED typically occurs 2 to 5 years before coronary artery disease, providing a potential window during which men diagnosed with erectile dysfunction can make lifestyle changes to prevent cardiovascular disorders. Bottom line, men with erectile dysfunction are at higher risk for angina, heart attack, stroke, heart failure, and cardiac arrhythmias compared with men who do not have ED. And men who develop ED in their 40s are even more likely to acquire cardiovascular disease than men who develop erectile dysfunction at an older age. So get serious. Talk to your partner. See your family doctor. Make a plan. Improve your lifestyle, for goodness sakes. Get your health conditions under control. Modify offending medications. Eliminate drugs. Moderate alcohol. Maintain dialogue with your partner. Live longer. Have great sex. This is Dr. Jim for Be Healthy, Be Happy, powering your path to happiness.